But yeah, I noticed I've done 8 treatments, close to 6 years now. I've noticed that if I come down like every 8 months, I never quite hit peak. I'm usually getting another treatment before the stem cells wear off.
Yeah.
So at about 10, 11 months, especially this last one, I could just feel my energy level just drop. And I knew I needed to come back.
Well, and that's what we tell people. We found they stay in your system about 8 months to a year. So it's usually around the 8, 9 month mark. You start like, you feel a little less energy. They're not in there helping out. So
Yes, some of the more recent papers I've come across, actually from China. I wanted to see if there's any connection between mesenchymal stem cell therapy with regenerating the thymus. And the
yes.
Chinese are doing this now because of the overpopulation of elderly,
Yeah.
and they want to,
Yeah.
they want to keep them healthy. And they're showing via, I forget if it was MRIs or CAT scans, they could see the regrowth of the thymus, which nobody has ever really documented before.
Yeah, and the other thing that we offer that has been proven too is, have you read the TRIM studies for HGH, human growth hormone?
Yes.
So that regenerates the thymus also. And so, I mean, I've been on growth hormone for 13 years.
Yes.
Nobody does
Yes.
more stem cells than me. I'm producing lots of T regulatory cells and I never get sick. I mean, I never get sick. It's incredible. So
Yeah, I admit I've done simoleon,
yeah,
and it's not as good as HGH, but
better than nothing. Yeah.
it's keeping my IGF levels high. By the way, Kathy with her disease has an IGF of 219
Whoa.
at 65 years
That's
of age.
really good.
It's super good. The simoleon keep me pumped up, but
Good.
I have to tell you, whenever I get sick, which is rare because we do a lot of business trips, I'll be sick for maybe one day,
Yeah.
and then it's out of my system. It's rare that I'm sick more than one day on occasion because I'm on the plane a lot, doing a lot of travel.
Yeah.
You just can't avoid it. But
No.
and when I do get sick, it's super light.
Well, and we see it in the blood work here because almost all our patients are flying down. I don't think I've seen a patient in the past 13 years that their white blood cell count wasn't a little bit low the day after they land. It's just all that recycled air on the plane.
Yes.
I mean, it wreaks havoc on your immune system. You're going to be fighting something.
Yes. But like you say, the TRIM studies are truly
Yeah.
revolutionary
Mm-hmm.
because, this is why for COVID patients at 65, the mortality rate started to really increase because your thymus turns to fat. You can't
Yeah.
produce T cells. The HGH studies are amazing.
Yeah.
And so,
Well, and they're saying it helps with nitric oxide production, which is huge for your arterial health. That's a big problem with the calcification of your arteries as you age, is not enough nitric oxide. So the thymus also helps with that. I mean, they say it should be classified as an organ, but it's still considered a gland. So it's, but it's not talked enough about, I think. So I'm glad you brought that up.
yeah.